Hi, my name is Ariana Maffey, and today's date is March 22nd, 2024, and I will be talking about hemolytic anemia. So, hemolytic anemia affects the red blood cells and bone marrow by the body destroying the red blood cells faster than the body is able to replenish them. So the functions of the cell that are impacted by this disease is oxygen transport, tissue oxygenation, cell membrane integrity, iron recycling, bilirubin metabolism, immune response, and coagulation. This disease can impact multiple organs along with organ systems such as the heart and circulatory system from the reduced oxygen delivery and increased heart rate, the lungs by having shortness of breath, enlargement of the liver and the spleen, the skin and the eyes from jaundice, the brain and nervous system from being dizzy and confused. Muscles are weaker, bone marrow has to overcompensate, and cardiovascular diseases of the heart, lungs, or cerebrovascular are worsened by this disease. And many bodily functions are impacted by the low red blood cell count, such as oxygen transport, energy production, heart function, again, skin and eyes from jaundice, kidney function, spleen enlargement, immune system mistakenly attacking the red blood cells, which could lead to other immune-related issues, blood clotting problems, lymph nodes, and the urinary system, such as hemoglobinuria. So the risks for hemolytic anemia, so other diseases can actually increase the risk to or trigger hemolytic anemia. Are cancers such as leukemia, lymphoma, infections such as Epstein-Barr virus, malaria, Rocky Mountain spotted fever, hemolyphus influenza disease, HIV, autoimmune disorders such as lupus, impaired bone marrow function, complications from transfusions can cause hemolytic anemia, and certain medications such as penicillin, quinine, methodopa, and sulfonamides. These are the risks that could trigger hemolytic anemia, and lifestyle habits can also increase the risk factors, especially people who don't get enough nutrients in their diet, people who frequently donate blood, and for those who have cold reactive autoimmune hemolytic anemia, cold weather can exacerbate the symptoms or exacerbate the triggers to hemolytic anemia, and also strenuous activity and excessive alcohol consumption. So genes involved in hemolytic anemia. So the mutations in genes encoding the red cell membrane proteins such as ankyrin, band 3, A spectrin, B spectrin, and protein 4.2. Genetic testing is highly recommended for individuals that have suspected hereditary hemolytic anemia, because it could accurately diagnose the specific mutation responsible for this condition. Being able to know the genetic cause, it allows for proper assessment and risk of passing the condition down to children, which actually could also help with family planning decisions as well. Genetic information can also help to predict the severity of the disease and be able to find the right treatment in time, because the earlier you can treat it, the less likely symptoms to become severe. So the gene mutation in hemolytic anemia, it's caused by a mutation in gene expression that affects hemoglobin structure or production, which leads to the reduced red cell lifespan. The mutations that encode the red cell membrane is the ankyrin, the spectrin, and the band 3. This leads to the structural abnormalities in the cell membrane. So the fragile and misshapen red blood cells are prone to hemolysis in the spleen and the liver, which actually results in the anemia, jaundice, splenomegaly, and in severe cases, organ damage can occur. So the treatment methods for hemolytic anemia are well established, and they do vary depending on the severity, the cause, and the type of hemolytic anemia the patient has. So the different treatments can include blood fusions, intravenous immunoglobulin, medications like corticosteroids, immune suppressors, hydroxyurea, and the plasma containing the antibodies could actually be separated from the rest of the blood, and then the plasma from a donor and the rest of the blood is put back into the patient's body. Surgery can be done to remove the spleen, blood, and marrow stem transplants are also an effective treatment, and also lifestyle changes could definitely help a lot. So is this a heritable disease, and how does hemolytic anemia affect the next generation? So hemolytic anemia can be inherited or acquired. So inherited hemolytic anemia is an autosomal dominant in most cases. It's not sex-linked. So hereditary hemolytic anemia is primarily associated with genetic mutations, but there are epigenetic factors that can play a role. So epigenetic modifications can affect the expression of genes involved in red blood cell production, function, and destruction, which could impact the severity and the progression of hemolytic anemia. Inherited hemolytic anemia can affect the next generation by the red blood cells potentially being fragile, breaking down prematurely while trying to circulate the bloodstream. The parents can pass down sickle cell anemia or thalassemia. They can have symptoms such as paleness, jaundice, darker colored urine. They can have weakness, and their spleen and liver could also be enlarged. So there's different treatments that different providers can do. So dietitians can actually provide nutritional guidance by providing personalized dietary recommendations to optimize red blood cell production, focus on iron-rich foods like leafy greens, legumes, and fortified cereals. Vitamin B12 and folic acid are also very big. Supplement management, such as receiving adequate vitamins and minerals through supplements. Dialysis technologists will monitor and collaborate with nephrologists and other healthcare providers, especially for patients who are undergoing dialysis, often from kidney disease. Technologists will monitor the blood parameters, including, hemoglobin levels. Maintaining optimal hemoglobin levels is essential for managing anemia. Working closely with nephrologists and other healthcare providers to manage anemia, especially in dialysis patients. Physical therapists can produce adequate exercise programs and teach energy-saving techniques, designs tailored, to prove their cardiovascular fitness, overall well-being. Regular physical activity can enhance blood circulation and oxygen delivery. And teaching energy-saving techniques can help patients managing fatigue that is normally associated with anemia. So there are a few different diagnosis methods that can be done. Several blood tests are used to diagnose hemolytic anemia. Laboratory tests such as direct antiglobulin test, which is called the Coombs test, peripheral blood smear, reticulite count, haptoglobin test, lactate dehydrogenase test, unconjunctated bilirubin test, and hemoglobin electrophoresis test. Usually in routine checkups, GPs might initiate the evaluation due to presence of symptoms, but patients, often get referred to a hematologist for further assessment and management of the condition that they have. Preventative technology. So unfortunately, hemolytic anemia is mostly inherited. So unfortunately, you can't prevent that. But patients can avoid substances that may exacerbate their condition. Certain types of hemolytic anemia can be prevented, such as reaction to blood transfusions, making sure that the proper blood and the proper donor, that you're receiving their blood, proper prenatal care, because RH incompatibility can lead to hemolytic anemia in a fetus, proper treatment of infections that can cause hemolytic anemia, such as malaria, Rocky Mountain spotted fever, Haemophilus influenza disease, and HIV, proper use of medications that can also cause hemolytic anemia, as I mentioned earlier, such as penicillin, quinine, methodopa, and sulfonamides. So an outlook for management of hemolytic anemia, it kind of varies based on a few factors, such as, the cause of the condition, the timely diagnosis, and treatment adherence. The prognosis, it does depend on the underlying cause of hemolytic anemia, and obviously, early detection and intervention play a significant role in improving the outcome, because the earlier you can diagnose and get treated, the less chances of it turning into more severe cases. It also depends on how well somebody manages their condition as to the long-term effects. And there is active research being conducted, focusing on developing new treatments and understanding the mechanisms behind the red blood cell destruction. And these are my references.